So here is my Terrazzo Kohaku, the one that had a nostril infection. I've sought out a lot of advice from people to see what can be done to treat the fish. I really thought about going with the injection route for the antibiotics, because the infection appears to have been internal and I couldn't really use a topical treatment. But part of me really resisted the antibiotic treatment because I felt like that was really the last resort. And I started noticing signs that, this fish may have slowly be fighting back against the infection of some sort. And I've been keeping it a salt bath treatment like this right now. It's in this bucket mixed with salt. I let it stay in here for like 5 minutes or so and try to get salt inside the system, and especially through the nostril. Hopefully that helps it, and it appears to have been helping. The last, it's been in treatment for like the last 4 or 5 days now. The nostril isn't as red anymore. I don't see the site being infected or spreading. Therefore, to me, that's a positive sign. And if I can get away with healing the fish by not injecting it, I would much rather do that. Let me see if I can rotate it around. Here we go. Yeah, see, it looks a lot better now to me. And I wasn't sure if what I was doing in addition to the salt treatment, which is sort of like putting a little bit of pressure along this area to help with the blood flow. Don't know if that actually helped. I mean, I want to believe that it helped, but I highly doubt that was the case. It's most likely that this fish was already slowly recovering, but the salt treatment kind of did help. And I noticed last time when I put a little pressure on here, it helped distribute the blood flow. So maybe just a little bit of that every day when I did the treatment may have helped. But I'm hopeful that it makes a full recovery. Right now it looks really healthy. Stays inside here and gets a salt treatment, and continues to eat, swims perfectly fine. But with every passing day now, the nostril appears to be getting back from being inflamed. See that the reduction in inflammation is very noticeable. Well, I'm hoping by next week maybe it'll make a full recovery, and then the redness will not be visible anymore. So appreciate the advice from people who saw the post I put on, and maybe even in some of the forums and on the video. So this was worth a try. I think like if had the infection been a lot bigger or much more noticeable, an injection would have been warranted. Yeah, plus right now I'm really happy with the way the recovery is.